it will require some stabilization procedure, right? So this stabilization, the major way in which it can be performed is through a surgery. So we need to think of which ones, which type of listhesis will definitely require a surgery. So what happen to be the indications for surgery in this situation? Okay, so here I think we had stopped with the flexion views. Is it? Yes. Flexion and extension views, which will give you an indication of how much instability there is. So if the slip increases with flexion or with extension, so it's more likely to increase with flexion because there is normally an anterior translation that does take place. Okay, so in that case, if it's increasing to a great extent, and has a potential for causing a neurodeficit or increasing one, if there already is, then in that case that would be a definite indication for a surgery to take place. Okay, now most of the dysplastic type of listhesis, because they show or they present earlier in the age, okay, they are developmental in nature, isn't it? So that is why the progress is also a faster one, because the progress is associated with a growth spurt and the developmental changes that are occurring in the spine, and many a time they already present with a neurodeficit. Okay, so the child may have a typical waddling kind of a gait with some extensor weakness, anti-gravity muscle weakness in the lower extremity. Okay, the ischemic type of displacement, depending upon whether it is an asymmetrical ischemic defect. So if it is a spondylolysis which is only on one side of the PRA, okay, the other side it is not as much. So the asymmetrical probably may not show much progression